When you see the scale of the injustice that is happening to people every day by no fault of their own as a result of America's healthcare system, I don't think you can do anything but want to get involved, but get engaged. I'm Walter Kerr, I'm a fellow with Renaissance Philanthropy, and I'm taking on the challenge of unfair medical debt. Healthcare costs in America are skyrocketing, and one of the reasons for that is because people too often get bills that include charges for things that didn't happen or for mistakes made on behalf of insurers or hospitals, but either way, people get stuck with the bill. When people get bills that are too expensive to pay, include errors, they often don't know how to fight back. This is a problem that found me, that found us. You know, many months ago, my fiance and I received in the mail a bill for a hospital visit for tens of thousands of dollars for what really was a pretty routine trip to the ER. And when we got it, we couldn't believe it was so big. We didn't understand why it took so long to receive the bill. This was a visit that had happened 2 years prior. Why didn't this go to insurance? We had all sorts of questions. And after spending weeks, months actually, fighting with the hospital to reduce the bill, eventually we succeeded. We got the bill cut to zero. And then I wrote about it online, and overnight, hundreds of thousands of people saw this story, and many people reached out to me, hundreds actually, with their own stories, many to share examples of how they fought back and won, and others to ask for help. So that really set me on this course of trying to understand why are hospital bills so expensive in America, and what can people do to fight back when they think that something wrong has happened. I've worked with probably dozens of people at this point to look at their bills, understand what were some of the driving costs behind them, and to fight back where we could see that there were mistakes made or where there were charges for things that didn't happen. Now I'm working with Renaissance Philanthropy to try to build tools to let patients do this on their own, and also to build tools that enable policymakers and others to identify where there are patterns among big hospitals, among big insurers, to target enforcement activity to make sure this kind of thing doesn't happen. You know, I think Renaissance Philanthropy is uniquely suited to be a home to incubate good ideas, to test out what works, to try a lot of different things, and then to figure out where you really want to lean in and start investing more of your time. Renaissance Philanthropy has incredible networks across a whole universe of different communities of people who want to help for all sorts of different issues. They bring networks that are unparalleled in terms of expertise, in terms of partners who want to work with you, in terms of people who want to provide funding to actually bring good ideas to life. It's so much more than any kind of traditional organization that houses ideas. It's really kind of a living organism of people who are sharing ideas and networks, and extremely collaborative, and it's the kind of place that you want to be if you want to bring ideas from inception and put them into the real world.